out right, but I don't know.
Well,
She
we
never
know
quite
it's,
gets my questions.
We know it's November.
It's a right
Yes.
time to talk about respiratory therapy. But if you don't mind, before we do, last week we talked about exercise, which of course Dr. Holm talks about every week. But we were talking about winter exercise and what's available if you don't want to go to a gym or pay for a gym. We were talking about different churches that might have free access to their activity centers. So I did make some calls this week. You can probably picture, if you lived here long enough, a number of churches that put in large activity centers. So those are the ones I called. Many of them have those activity centers because they have a large daycare program or child care program, so they're really not available during the day. However, the two that we mentioned are the ones that really do offer their facilities for anyone who'd like to walk during the week. First Methodist Church and St. Thomas More Church, both of them in Brookings. First Methodist has walking inside at their Community Life Center, which is right behind the church. I think most people, it faces 6th Street. So if you know where the First Methodist is, the Community Life Center is just behind it. And you can, there's a large parking lot there, no problem getting there. You can walk inside any age, any time, no fee, and it's 8 a.m. to noon, Monday, Tuesday, Thursday, and Friday. They skip Wednesday because young kids get out of school early and they have programs for kids on that day. Then they have Healthy Movement, which is an exercise class for anyone, but mainly older people are in there, and that's at 10 in the morning every Tuesday and Thursday, no charge. So it might be really fun for you to stop there on a Tuesday or Thursday, 10 in the morning, Healthy Movement. Anybody, well, anyone's welcome, but I'll bet the majority of people are over 60, wouldn't you think?
I think they are.
Yep, there you go. All right, and then St. Thomas More has walking inside from 8:30 to 5:30. So First Methodist stops at noon. You're welcome all afternoon at St. Thomas More, 8:30 to 5:30, 5 days a week. But they do warn you, on Wednesday it gets a little busy with kids in there. So once again, Wednesday may be your day to exercise indoor in your own home rather than at either one of these churches. They also offer a free aerobics class. And aerobics is a wonderful exercise for anyone, any age, and they offer this class Monday, Tuesday, and Thursday from 5:30 to 6:30, and Saturday 10 to 11. So again, a lot of things available for you exercising in the winter. They also have at St. Thomas More a men's basketball league Tuesday and Thursday at 7:30. Any men in town are welcome to join. Just come over and play basketball. So both of these churches offer their facilities, their activity center for community use. You do not have to be a member of the church. You do not have to pay anything. Just show up. If you want to walk inside, you've got a place. The last one with a large activity center that I want to mention is First Lutheran. When I talked with their secretary, she said, if you'd like to walk at our activity center, just call first and we'll tell you if it's available. If it's available, you're welcome to it. So they don't have a scheduled time.
That's great that there are lots of opportunities in town. And of course, if it is good weather, then we encourage the outside activities so you get some of that vitamin D. Now, a day like today and when our very cold winter days when we're concerned about falls, then our indoor activity, our centers would be great for getting that exercise.
Thoroughly agree. Well, I spoke for such a long time, I think we're going to take our first break. But we hope you listen because we have a respiratory therapist, Janie Isom, with us today, and we're going to talk about respiratory care, and we'll start that discussion right after these words. Welcome back to Prairie Doc Radio. I did an awful lot of talking the first couple of minutes, and I'm going to move the mic over to Joni and to Janie, and they can discuss respiratory therapy.
Well, thank you all for listening. We bring up this subject for a couple of reasons. It is a special month where we think about the Great American Smokeout, but we also, tomorrow night on Prairie Doc TV, on call with Prairie Doc. We have we have two pulmonologists, and our discussion will be about respiratory illnesses. So we have asked Janie to come in and talk about some of the common respiratory problems that we see. And I'll start with talking about pneumonia and influenza. Those two things are ever present. So what would you like to tell the audience about those two?
Well, I think first of all, the most important thing is if you haven't had your immunization for influenza, you definitely need to do that for sure, because it is going to be here, and there's no escaping it. So I encourage everyone to get their immunization for the influenza, and also those at-risk patients who are older and may be in that category of client who would benefit from the pneumonia vaccine. I know that's available as well, and we do see a lot of pneumonia in our older patient population that's starting this time of year on through April. So we're heading into the busy season. We call it "'tis the season to be wheezin'" in our department. So
and that's for adults 65 and older, or unless you may have some predisposed problem, and you'd want to talk with your primary care provider about receiving that in the earlier 60s. But that's an individual decision. So that is an important vaccine, and certainly can decrease the risk.
Many of us did have that shot when we turned 65 or whatever, I among them. Is there any reason to have a booster, or does that do it for you?
You know, I don't do adult medicine. I don't think at this point there is one, but I would recommend that you talk with your primary care provider about that.
But mainly it's important to get that
Get
pneumonia.
that first one.
Yeah, very important.
So why is it that the older population, Janie, help the audience understand, what is it about decrease or the increased risk? Does it have to do with pulmonary function, with not taking these deeper breaths, with not having the capacity that a younger person has? What puts them at higher risk?
well, I think a lot of those things that you mentioned probably come into play. A lot of our older clients or patients have other predisposition to other illnesses, whether they may have some lung disease, underlying lung disease, or heart disease. Their ability to fight infection may not be as good in an older person as in a younger person. So I think there's a lot of things that come into play. But one thing to keep in mind when you're out and about, and I think we see more of this during the holiday season, is everybody's visiting. Everybody's going to family gatherings and going to the assisted livings and nursing homes and what have you, and large gatherings of people at church. Just be mindful of hand washing.
Excellent.
You know, we touch our nose and our mouth hundreds of times a day without even realizing it, and I think that's a common transmission, is hand to hand. You're shaking hands, you're touching your nose and mouth and not washing our hands. So when you're at Hy-Vee, take advantage of those sanitizer wipes. So wipe off the cart, and at Walmart and wherever you can be. I mean, it's a good idea to carry some hand sanitizer in your purse or your man purse if you happen to have one of those. You can't keep your hands clean enough, so that would be one of the first things I would advise people.
That sounds great, and it is very important. And with our closer contacts in the winter, because we are together, we're certainly sharing our germs a little bit more. I kind of think about the deep breaths. Now, when I see patients in the hospital, things that you do to work with them is have them use an inspirator or some kind of a device to get them to take the deep breaths. If someone is older and they're living a more sedentary lifestyle, they may not be taking those really deep breaths and expanding the lungs. So those would be things that exercise, for one thing, encourages you to do. Because you are huffing and puffing, you're taking the deeper breaths. So if you aren't exercising, still think about it. Still think about taking those deep breaths at home. I don't know if that particularly would help, but it certainly isn't going to hurt.
No, it's not. And if you are a person who isn't very active physically, for whatever reason that may be, you have decreased mobility, definitely your lungs need exercise just like the rest of your body. So I encourage everyone to just take those really slow, deep breaths in, let it out nice and slow. You can do that 5 to 10 times and a couple times an hour and exercise those lungs just like the rest of your body.
Now, don't you think that we have seen an advantage over the last 20 years with a reduction in smoking?
I do, and I think that's helped a lot. However, I do want to bring up the issue of lung cancer in women. I'm really passionate about this right now, as I have a family member who was just diagnosed with stage 4 lung cancer, who's only 50 years old.
Oh.
And in doing some research, the American Lung Association just sponsored yesterday what they are calling Lung Force, and that's trying to spread awareness about the incidence of lung cancer in women. And I bet I myself, as a respiratory therapist, did not know that lung cancer is the #1 cancer killer of both men and women, above breast cancer, above colon cancer, above prostate cancer. And the reason for that is there's not a good screening tool like we have. For colon cancer, we have colonoscopies. For breast cancer, we have mammograms. For lung cancer, we don't really have a standardized screening tool. So by the time someone is diagnosed with lung cancer, they less than half of those people are alive after 1 year. So primarily, once you're diagnosed with lung cancer, if it's advanced, the survival rate is poor. 71,000 people will die this year alone from lung cancer. And lung cancer also kills 2 times as many women as any other cancer. And there's only 18% of those people that will have a 5-year survival rate. So this is a really big cancer killer of anyone. And you don't have to be just a smoker to get lung cancer. You can get cancer from radon in your home, which is something you want to get checked out, especially if you live in an older home. If you have a family history of lung cancer, air pollution, the smoking is the #1 indicator for lung cancer. But if you've lived with a smoker and breathed secondhand smoke all your life, like I did, my parents all smoked, my grandparents smoked, I grew up breathing all of that in. So I just want to encourage anyone, if you have a dry cough that doesn't seem to go away and doesn't seem to get better, you definitely need to get seen, because this is a big problem, and unfortunately we're not finding out about it until it's too late for a lot of people.
Are there other indicators besides that dry cough?
Well, if you're coughing up any blood, if you have any chest wall pain that doesn't seem to go away, fatigue, weight loss with no other real explanation, shortness of breath, that type of thing. So I would encourage anyone with any of those symptoms that can't be explained by any other illness to definitely talk to their primary care provider about it. And if you want more information, you can get online at lungforce.org.
What is that, Janie? Lung Force?
Lungforce.org.
Okay, I
Great
think people will do
information.
that. We need to take a break now. If you have any questions for our respiratory therapist, Janie Isom, please give us a call. We'll be back right after this. Prairie Doc Radio, we're happy to have you listening today. Joni Holm is here with me, and also Janie Isom, who is a respiratory therapist and just kind of blew us away with her information on lung cancer. I had no idea that, I thought maybe for men, but for men and women it's the #1 killer, and we just don't have an easy way to determine if someone has lung cancer. So I think it's worthwhile for you to mention those symptoms that might make it worth you checking with your doctor, just to make sure. But if lung cancer is caught early, like other cancers, there's help. But if it's not good, right?
That's correct.
So those symptoms
explained by a cold or upper respiratory infection, that just this nagging ticky cough that doesn't seem to go away. Chest wall pain, shortness of breath that you maybe didn't have previously to dieting. All of those would be indicators to see your primary care doctor, and it can be as simple as a chest x-ray. Am I right, Joni?
Just to diagnose it, yes.
Yes.
It would be at least give your healthcare provider a hint and or abnormal on the chest x-ray.
My brother-in-law, about 5 years ago, died of lung cancer, but his was diagnosed because there was a research going on, and he agreed to be in this research, a former smoker. Into this program within days of first testing him, they was diagnosed with lung cancer, and he'll be good longer than that. And he lived 3.5 years, but it was diagnosed before.
Wow.
He was so proud of being, but yet there he was,
Mm-hmm.
lung cancer. It's a tough deal.
Well, if we're in our state, we're in around 18 to 20% of people smoke, and those lower. But over the last 20 years, that's a significant decrease. The message is getting out, and still a significant reduction. Fighters as respiratory therapists to quit smoking is to never start.
That's right, because it is really difficult to matter. It's tough. Yeah, Joni,
They're
what
not
do you
good.
know?
Decrease in the toxic substances, but I do. The hope was that it would reduce the number of people smoking cigarettes, and it made the number of young people starting
Right.
because they think cigarettes. So all in all, it's best not to go there, folks.
I agree.
Now, certainly the South Dakota Quit Line is an excellent context. The Nicorette, there are different ways that people who have used hypnosis.
One that used to use hypnosis, but we do who want help in quitting, we definitely give them information for this. This doesn't cost any money, and this is something that our state has made. It has been extremely helpful for a lot of people. So if you want more information about the South Dakota Quit Line, you can go online or call our department at the hospital and respiratory care. We've got all that contact information for you,
Right.
and would love to make it available to anyone who ever wants more.
My understanding of the Quit Line is that they do help with paying for or providing. The key thing that I think is that it's, of course, throughout the state, but to have reminder symbols to help support you as you are quitting, those kind of things could be.
Pills that people take to try to avoid smoking.
Right.
I'm just wondering, Janie, we talked a lot about lung cancer, about smoking. I would think as a respiratory therapist, you cover a lot more fields than that, right?
We
Are you
do.
involved in
Our sleep technologist, but yes, we do have our sleep diagnostic center as part of our department.
Okay, and sleep studies? Is that
Yes,
what usually occurs?
you would talk to your primary care doctor, explaining any symptoms that you might have: daytime fatigue, snoring, difficulty sleeping or maintaining sleep. Those would all be indicators for needing a sleep study, and you would get a prescription from your doctor and order it on up for you, and we'll take care of you over at
All
Perkins
right.
Health System.
Sounds good. And you noticed nebulizers. I usually think of those for young kids. Do adults use nebulizers too, and for what reason?
Absolutely. And you think of people with asthma or lung disease or reactive airway disease or COPD, as you hear commonly, may use an inhaler, and that's got a medication in it, a bronchodilator. Well, a nebulizer is just a different way to administer that. So a nebulizer is the liquid form of the medication that's in the inhaler. So it allows those people to coordinate their breaths enough to use an inhaler, which lasts about 10 minutes, and that medication.
So that's the reason for adults use it. I just picture young adults use it as well.
No.
That's a different mechanism. The medication go directly to the lungs versus taking a pill and having it go through the bloodstream and broken down. So an inhaled method can work faster and more efficiently in the lungs.
Questions concerning respiratory therapy, give us a call at 692-1430. We'll be back right after these words. Prairie Doc Radio. I'm Joan Hogan. In the studio with me is Joni Holm. Dr. Holm is catching his deer, right?
Correct.
Okay, or what do you, not catch, I'm not a hunter. What do you call it? He didn't catch him and save him.
Shooting.
Shooting, okay. You can tell I don't
Yeah.
come from a hunting background. But at any rate, he is shooting his deer and bring home, not the bacon, but the venison. Bring it
Correct.
home. All right, well, good luck to him. But we're happy to have Joni here. And with Joni is Janie Isom, and Janie is a respiratory therapist. We've been talking quite a bit about that, but we did have a question come in that has nothing to do with respiratory therapy, and hopefully Joni can cover this because she is a nurse practitioner with the Brookings Health System. Joni, the question is, what is your opinion on taking turmeric capsules? I've heard some good things about a dietary supplement, which is turmeric capsules, for overall health. Are there side effects? Is it safe to take with other prescription drugs? And the person that wrote this in also said, we enjoy your program on Wednesdays and TV. So she's an avid listener and watcher, and she would like some answer from you on turmeric capsules.
Well, thank you very much for listening and watching. We're very happy to have the audience out there. I can answer this broadly. In general, supplements are not studied. We don't have the scientific background to be able to say a lot. And, I haven't specifically studied turmeric, but in general, I would say I doubt that it is of high benefit. I hear about countries that have a lot of turmeric in their diet, and they talk about some benefits, and I can't even tell you. I want to say maybe GI type benefits, but I'm not positive. But that comes in a different form. That comes in natural with the diet versus a supplement. So I would recommend that you do more study on it. I'd recommend you talk with your primary care provider. And in general, I'd be a doubter that it would make a lot of difference in your health.
When you mentioned GI health, another thing that came to mind is the probiotics. And that's supposedly helpful. And that's an over-the-counter as well.
Right, and you and I have both talked about that, in that it was recommended to me before I traveled internationally, and coincidentally, everybody on our trip got sick but me, and I took the probiotics. I cannot tell you scientifically about exactly what that was doing. It does help the good bacteria to grow in your stomach, and maybe it helps the bad bacteria not have room to grow. I think it's probably worthwhile to pick up some probiotics if you're going to be doing a foreign trip in
Or
a
just
country that
if GI problem, and instead of that, try the probiotic possibly.
possibly.
And yogurt would provide the same. Doesn't
It
yogurt
would. I
have
don't know that the
probiotics?
quantity is as high.
Oh, okay.
But
All
yogurt
right.
in general is a good food, and we do recommend it for people or they may even just increase their yogurt intake, and that can help them to fight those side effects.
Okay, so if you were thinking of turmeric for your GI tract, we suggest probiotic instead. Again, we don't have the science behind
scientific
it.
data.
I know, it's tough, but,
Right.
and that's the problem with so many of the over-the-counter
Supplements.
that they're just not tested, and
Right.
they have no scientific background.
Right.
Well, we should get back to our discussion with Janie.
I just wanted to mention briefly RSV, being the more on the pediatric end of things. Respiratory syncytial virus is a pretty common, a very common illness that basically everyone gets, but in some children it can be severe. And the main thing that I talk to parents every day about is watching your child's respirations. Even without counting, you know what looks normal, and you know what that chest looks like. I always pull up the shirt and have parents look at the child's chest, and we're talking infants in particular. So if that changes, if your child is not breathing that normal 20 times a minute, 25 times a minute, and you're seeing them huffing and puffing, even if you don't hear a difference in the sound, but you see the difference in their breathing, and then particularly if they have something called retractions, where you will see their chest sink in between their ribs, above or below the sternum, that's showing that your child's really working hard to breathe, and it would be an indicator to get them checked. And you see the children in the hospital when it's more severe,
Yes, we do.
and that's a time when we're using oxygen, when we're using nebulizers, a variety of methods. This is a viral illness, so it's not an antibiotic treatment most of the time, but it's supportive.
Yes. And especially in an infant, newborns to 2, I would say, those little ones are definitely at more risk for getting sick enough to be hospitalized, where they require a lot of suctioning of their nose. They get really junky sinuses and difficult to breathe, and kids are nose breathers, right? And so we have to keep that nose clean so that they can breathe.
That's one of the most difficult things with just the common cold, and I know we're getting close to our time here, but parents, that bulb syringe is important, and it is helpful, and there are some other methods that you can pick up at drugstores that are a little more effective, a little battery operated. So just with the common cold, helping the nose get cleared out, but if the breathing changes, that's when we want you to either go to the emergency room or get into a primary care provider.
Well, thank you. We are short on time, and we do hope all of you have enjoyed our Prairie Doc Radio program. As always, you can hear more from Dr. Holm online at prairiedoc.org, and you might also learn more about the exciting activities of the Healing Word Foundation. And be sure to check in tomorrow night, 7 o'clock, South Dakota Public Television, when the discussion on respiratory care will continue with 2 physicians and Dr. Holm. Joni, thanks for being with us. Janie, thank you so much for being here. Janie Isom is with the respiratory therapy at the Brookings Health System. And thank all of you for listening to Prairie Doc Radio. I'll close with Dr. Holm's weekly reminder, stay healthy out there, people.